Hello, and welcome to today's webinar, Digital Wound Imaging and Documentation with Swift Skin and Wound. This webinar is part of the WoundSource Wound Care Product Navigator series. The Wound Care Product Navigator series is an easy-to-access, interactive learning lab for healthcare professionals to get the latest information they need on the wound care products available to them. Each webinar segment will take a deep dive into a specific product technology. Our sponsor for this installment is Swift Medical. My name is Emmy McCauley from WoundSource, and I will be the moderator for this event. This program will provide an in-depth look into Swift Medical's digital wound imaging and documentation solution, providing information on the features and benefits of Swift Skin and Wound, as well as a live product demonstration. This presentation will be followed by a question and answer session, so we encourage you to submit your questions to us throughout the program. As a reminder, the content for today's webinar is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment, nor is it intended to be a substitute for manufacturer instructions. Always refer to your facility protocol in the assessment and treatment of patients. The views and opinions expressed in this program are solely those of the presenters and do not represent the views of WoundSource, Kestrel Health Information, Inc., its affiliates, or subsidiary companies. Now I want to take a moment and provide you with an overview of your webinar console. At the bottom of your console are application tools that you can use during the webinar. To submit a question to our guest speaker, please select the Q&A app icon on your screen and type your question in the field provided and select Submit. We will try to get to all of your questions during the question and answer period. You can expand your slide area by clicking on the Maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. If you have any technical difficulty during the program, please click on the Help icon, which is the app with the question mark. This covers the most common technical issues. To access information about today's guest speaker, you may select and expand the Bio app found on the left-hand side of your console. Our sponsor has included additional information on today's product. On the right of your console, you will find a list of resources available for download. You may also access this information by selecting the document icon in the bottom tray of your console. This webinar is being recorded and will be made available on demand. If you have any other requests or questions pertaining to this program, please contact our sponsor using the Contact Us app located on the tray of your console, which is the application with the email icon. Now, before I introduce today's guest, please take a moment to complete our quick poll, which should display on your screen here momentarily, to help us find out how many have joined us for today's session. The question is, how many people, in addition to yourself, are watching the webinar with you today? If you are attending this webinar by yourself, simply enter a 0. If you are in an in-service setting, an estimate is fine, and we thank you for your response. At this point, I want to welcome our featured speaker, Amy Casada. Amy has over 15 years of post-acute care clinical experience, as well as experience overseeing departmental budgets, clinical operations, staffing resources, and major EHR configurations in a wide range of healthcare facilities and projects. Amy's unique blend of clinical skills and digital implementation knowledge has helped her transform facilities into world-class leaders in the adoption of digital health innovations like Swift Skin and Wound. Amy, thank you so much for joining us today.
Thank you. I'm going to thank you for the introduction. So a few things we're just going to go over is about Swift Skin and Wound, a high-level product overview, how it works, some of our features that are available different cross contexts, how we demonstrate our results in the settings, and then into our Q&A section. About Swift Skin and Wound, we're a digital management company. We're used in over 1,700 facilities across the United States, as well as across all the different provinces in Canada. On average, we're monitoring over 300,000 patients per month, assisting with 100,000 or 10,000 wounds per month we're monitoring, which is also helping with streamlining $2 million in reimbursements. We are integrated with Point Click Care and Healogics, and we've seen expansive growth with these integrations. Our product is a 3-part product. We use a Swift Helix, which is an FDA-registered device. This allows for consistent image capture irregardless of lighting. Our Swift Skin and Wound application is the point of visioning technology that our clinicians use at the bedside to capture the image as well as do the automatic measurements. And then in real time, that is fed back into our Swift Skin and Wound dashboard. So the office and your nurse managers are able to see what's going on in the field in real time. So with that, I'm going to switch over and share my mobile device. With Swift Skin and Wound, you log into the mobile application. Once you're in the mobile application, you simply swipe to find your patient list. If your agency has multiple locations or that well. So we're simply going to type in our patient's name, pull up our patient, and we're going to simply tap on the plus button. So from this point, we're going to hover over the wound so we can see our blue helix. We can zoom in. Our helix has turned orange, so I'm simply going to capture the image. I'm going to color balance with that helix and save it. At this point, I'm going to trace the wound, refine it. So what you can see is that it's pulled in to the length and width and the edges of the wound. So I select done, and it has defaulted to max length and width. In my agency, we measure head to toe. So what I'm going to do is simply touch the length button and adjust the arrow so you can see it and mark the patient's head. I'm going to select done. So in here, I'm going to identify the deepest area, manually add the depth. If my wound has undermining, I'm simply going to trace with my finger around the edge of the undermining. Again, manually entering the undermining. And the same with the tunnel. Select tunnel, simply draw with my finger. The yellow line will indicate, and again, enter the depth of the tunnel. Done, and select save. So what happens is, as your clinicians are out in the field, they're getting real-time information. So it gives us the true surface area, the length and the width, the depth, undermining, and tunneling. So from here, I'm simply going to select what type of wound this is. If there's a subset associated, I will complete that as well. My body map, I simply select the body map and rotate it. I can zoom in and out and select where it is on the body map. Was this acquired in-house or was this present on admission? As well as the age of the wound, if I know that information. And then this is a persistent field. So irregardless of the clinician that's out in the field, the type, location will be consistent throughout their entire stay. So at this point, I can go through a comprehensive characteristics of the wound bed. I can select what type of tissues I see. Is there evidence of infection? And if there is, what am I seeing at the same time? And anything else that I'm seeing, if I may see bone or if it's bleeding very heavily. As well as what is the exudate? So how much, what is the type, and what is the odor after cleansing? So I can continue through peri-wound and a pain at the same time. But what you'll see now, as I start entering the information at the point of care, it's calculating for you. So my push score is being calculated for me. As well as I pull this up, I can see the tissue type in the wound bed as it's entered at the point of care. So then if our patient Amy was seen last week And now the second nurse comes out the following week. She would simply find the same patient, go back into the wound, and we're going to hit a reevaluation button. So what you're seeing is a blue arrow indicating the patient's head, as well as this ghost overlay. So we're almost seeing through the eyes of the clinician before us. So then I simply hover over the wound, capture, balance, and do my area. And then we'll save just for the sake of time. At this point, what you're seeing is you'll see the progression of this wound in real time. So it's giving you an immediate at the point of care, the changes noted into this wound. As well as when you're in here, the more consecutive wounds you have in the series, you'll see a progressive vision through the application. So with that being said, I'm going to switch over to our dashboard. So as the dashboard comes up, you'll see that this is real-time information related to the patient. We have a compliance dashboard, so ensuring that your staff is being compliant with the information. Is it signed? Is it locked? Who created? Are body types missing, right? We need to drive compliance with it. And all this is filterable down to the type of evaluation we have. Your wound dashboard overview, you can look at your wound dashboard in real time. So this what is happening is the amount of wounds that you'll actually see in your agency. So this is not patient. So this is if one patient has 3 injuries, you would see all 3 injuries listed, as well as broken down into different statuses, improving, deteriorating, stall. So this kind of will give your WOCNs or your WCCs an area of where to focus. So then I can actually click down into this patient and give them more detailed information. So you can see a skin, ABPI, Braden's, and then as I click into here, we can see the information that happens. We also have a risk dashboard, so we can change the filters here. So if I was doing a QA and say looking at quarter 4 for last year, I could change my dates and go back, as well as I can change the views. It's the same information, but it's just viewing it by location or how you have your agency divided. And then we have a surveillance dashboard here as well. So if we wanted to look at our past 90 days, we can drill down even farther into our patient population. So if we specifically want to look at pressure, we can go and break down to pressure. And if we're very focused on looking at discharge patients, we can include those as well. And if we're looking at additional locations, if I want to see location facility breakdown, I can do that as well. As well as I can save my filters here for frequently used dashboards. So then from here, I can drill down even farther, selecting one of these blue hyperlinks and then looking at the data in a different way. All this here is downloadable and exportable to CSV format for any additional information that your agency would like to use. So with that, I'll stop sharing my screen for the dashboard. So just in summary, I'm reviewing the product features. The wound measurements is a true surface area, length, width, depth, undermining, and tunneling. We have an auto depth feature that is out as well. It is HIPAA compliant at rest and in flight, meaning that nothing is saved to the mobile device itself. It's all double encrypted and stays in the application in flight and at rest, so there's no chance of a HIPAA breach. We have multiple workflows. wound evaluations, as well as risk assessments. So whether it's a Braden or a Norton, whatever you use in your area of the country, we support those. We also have automated clinical alerts and education at the point of care visioning for your nurses. So if your nurse is confused as to what is the difference between a stage 3 and stage 4, we have that information as well. And then the real-time overview for analytics and reporting. So as I showed, a few different dashboards and a few different views, an overview, a risk management overview, and then a compliance dashboard, all with CSV exports as well. So leading us into our demonstrated results, we've had multiple studies related to demonstrating the results of using Swift Skin and Wound. In one study that was just recently published, it's actually reducing the pressure injury prevalence over a 6-month period. The location started at 24%, and within 6 months, in combination with using Swift Skin and Wound and an amazing IDT team, they were able to lower it to less than 3%. In another study that we did, it's actually reducing the healing times that we see on stage 2. And then the average time spent to reduce that burden on the overhead for your management or back office running a QA analysis. So with that, I'm over to a Q&A, and I'll turn it back over to Emmy.
Thank you so much for that presentation, Amy. As mentioned, we're now opening up the floor to questions. If you have a question for Amy related to today's program or Swift Skin and Wound, please submit your questions using the Q&A app found on your console. We'll try to get through as many as we can in the next few minutes. Now for our first question, why is it important to take images of the wounds in the overall care of wounds?
Wound care we see is very not brought to the forefront of medicine. We see, lots of studies and lots of information related to all different types. But actually to be able to image the wound consecutively week over week or bi-weekly or however it is, we see better reimbursement because it's an accurate documentation of what is happening in that time point. We're also seeing the use of more digital management solutions where remote users are logging in. So if your agency has 1 or 2 WOCNs with 2,000 or 3,000 census, those WOCNs are able to divide and conquer and actually see the patients that they need to. As well as the last piece with litigation, where the family's going to take a picture no matter what. So it's easier to have a consistent image week over week or bi-weekly that actually shows the true wound in a consistent manner.
Thank you. Does the automatic wound measurement include tunneling, undermining, and depth?
So currently our solution has automatic measurements for length, width, and depth. Tunneling and undermining is still a manual format. We can't right now expect the camera to see what the human eye can't see. Who knows what the future holds and what AI and deep machine learning will help us, but currently it's length, width, and depth is an automated process.
Okay. How do you examine wound closure rates over time, and how do you manage a patient's risk of acquiring a new wound?
So great question, 2 parts. Managing a patient's risk of acquiring a wound, we see prevention is key. How can we be proactive versus reactive? So by using our solution, we have a couple different ways with risk management for using Braden tools or Norton tools, as well as a total skin assessment. So capturing what's going on with the patient on admission within those first 24 hours. So you can see throughout your staff who's being compliant, as well as at the patient level, who's highest risk, and ensuring that those interventions are in place. And then with the consistent measurement over time, it will drive those wound rates in a positive direction, right? I could teach 10 nurses in the room with me to measure the same way, and we're still going to get a degree of variance. So this is actually looking through the eyes of the clinician before them, so you can drive compliance with it, as well as notice those subtle changes in a more proactive versus reactive way.
Great. Can your solution be used with an EMR such as HCHB, Athena, or WellSky?
So we have customers that currently use Swift Skin and Wound with their EMR, and then we also have customers that use it in a standalone solution.
Great. Does the point of care application characterize or stage the wound as well?
So currently there are staging glossaries in the application on the mobile device to assist your staff with staging wounds. So that still it's a manual selection that the nurse has to select the stage.
Does lighting affect the measurements?
So the helix that we use, the blue little dot that you see in the application, that's part of the three-part series, the three-part with Swift Skin and Wound. So our helix is an FDA-registered biomarker, which we call the helix, and it's used to get consistent image capture, irregardless of lighting.
Thank you. Do you see or know of any specific cases or legal issues pertaining to picture documentation?
So we're seeing accurate and consistency with using a digital wound management solution. This is being used to combat litigation in multiple settings. We know that those families are going to be taking a picture. A picture says 1,000 words in a litigation setting. So if your agency has consistent week-over-week documentation showing the progression of that wound in a positive direction, or sometimes, unfortunately, in a negative direction because the patient is non-compliant or in an end-stage process, we see that this is being a very strong defense to combat that litigation.
Right. And how would you recommend usage, such as taking a picture of everyone's buttocks on admission or perhaps only hospital-acquired pressure injuries?
Yeah, great question. So we can work with your organization to customize clinical workflows based on industry best practices. So we have a total skin assessment that is available in our application, which a lot of our customers use on admission to document what was present on the patient within the first 24 hours to defend those hospital-acquired or center-acquired pressure ulcers.
Great. And how can a user make sure the measurements taken by Swift Skin and Wound are accurate?
We actually have a published study that's called +1. So in there, it actually validates the accuracy of the measurements irregardless of the user, doing an interoperator study. Great.
And do you have an individual wound assessment or report for the chart?
So our individual wound evaluations are specific to the patient as well as to a multiple wound level. So if one patient has 5 wounds, you're going to have 5 series for 5 specific wounds on one patient level. So in short, the answer is yes.
Great. And is this app considered a regulated, or is this app regulated as a medical device?
So the Helix is regulated as an FDA-registered device, but the application is used as a tool and image capture and digital management solution.
Is there a separate application to digitally obtain the depth?
So our Skin and Wound mobile application has 2 versions. The one that I showed you today is just a surface area length and width. And then we have a second version that includes an automatic depth measurement.
Does the distance of the camera from the Helix make a difference in measurements?
When our team comes out and educates your staff on using it, we have an optimal distance that we suggest when using it. So we tell roughly 12 inches, or as I teach the nurses, like your elbow to your wrist is the ideal location, and then you would zoom in to capture the wound in that box. But the point of the Helix is to capture the consistent measurement.
Great. And does all the data entry need to be done at the point of care?
So we have multiple different formats based on the user context settings. So some of it can be done on the point of care and some can be done in the dashboard, as well as some of our users only use it at the point of care. So it's flexible in that way.
Thank you. And how could someone interested access this app?
So our application is based on user licenses or agency licenses. So you can reach out to our sales team at swiftmedical.com or email sales@swiftmedical.com to get information on using the application in your agency or your setting.
Thank you. That is all the time we have for today's webinar. Thank you so much for all of your questions. This is just a reminder that we have included a link to additional product resources under the document icon. Please be sure to review these resources at your convenience. You may also visit the Swift Skin and Wound product page on woundsource.com for more information on this product. This webinar has been recorded and will be made available in full on demand after the program. Please look for our follow-up email that will alert you when the on-demand recording is available so that you can review any material you missed or simply go over the program again. Also, you will be redirected momentarily to a brief survey. We appreciate your participation in this questionnaire as you leave the program. I would like to extend a warm thank you to Swift Medical for sponsoring today's program. On behalf of Amy Casada, as well as the teams at WoundSource and Swift Medical, thank you for joining us and for taking the time to view this webinar. Have a wonderful day.